baby tooth cavity, should I fix it, or this is just a baby tooth, it's gonna fall out? Well, a lot of questions we get about baby teeth cavity. This is my expertise. I'm Dr. Olga Dolghier. I'm a board-certified pediatric dentist at Palm Valley Pediatric Dentistry and Orthodontics. Let's talk about cavities on baby teeth. When do we fix it, or when do we let it go? So why do we need baby teeth cavities? It all depends what needs to be done and how many cavities your child has. If you have a young child who does not sit willingly in a dental chair and has one cavity, and it's proven it's one cavity or two cavities, we're probably gonna stop the decay with non-invasive approach. We might use SDF, which is silver-based medication, which stop decay from progressing. And we'll see him in 6 months. And then we'll look at that tooth again and see if you're doing your job at home, if you're brushing and flossing and your kid is doing great, we're not sleeping with bottle at night, then we might revisit this question again, maybe apply SDF again, maybe cavity completely stop and we remineralize the tooth and nothing needs to be done because you are doing an excellent job, not us, you do. And if I have a 2-year-old which sleeps with the bottle and all his 4 front teeth completely destroyed by milk, unfortunately sometimes with nursing as well, and solid food combination with nursing can cause problems, especially nursing on demand with teeth present and not brushing at night. In this case, it depends on age. If your kid is under the age of 2, in my practice, we wait. We would again apply the non-invasive medication SDF and wait until child reaches the age of 2, a little bit more root formation of those front teeth, and then we can treat him with crowns under general anesthesia. Why can't I leave young kid with decay alone? Tooth will fall out, right? Well, keep in mind, first of all, the tooth is not falling out. All of them don't fall out at the same time. So between 6 and 8, your kid will lose upper 4, lower 4, variation plus minus 2 years. And then back teeth will lose gradually. We lose molars about the age of 9, then we're gonna jump in canines, and then the second molar is about 12, 13. So it's a process. So think about this 2-year-old with a decay front teeth, okay? If we do nothing, most likely they will develop next stage of dental infection, which would be an abscess. And abscess is infection from the tooth goes through the root of the tooth into the bone, and then you see like a pimple on a gum. It looks like a gum wheel. His body cannot fight that infection or localize it, then we might have facial swelling and it becomes a big deal. Your child needs to be on antibiotics. I've seen a bunch of kids who unfortunately had to be hospitalized for dental infection. When I see a 2-year-old with big cheek and eyes shut, not much I can do at this point. I have to send them to hospital for IV antibiotics, and that tooth needs to be pulled immediately because this is now not a tooth emergency. This is head and neck emergency, and because infection can spread, potentially you can die from dental infection. Don't want to scare you, rare, but you have to think teeth is the part of your head, and infection can travel through cavernous sinus to your brain, can travel to heart. So we take dental infection very, very seriously. So that little dot on your tooth, a little cavity, is not just a simple cavity. When do we let it go? If your kid is 8 years old and his 2 front teeth develop like a small cavity on them and the tooth is wiggling loose, I will tell you, go home. Loose teeth is not my problem. Loose teeth is your problem, and you need to wiggle it at home because loose teeth is normal. It's normal exfoliation. So your kid should get a skill and learn how to wiggle them out because they need to lose 20 baby teeth. 20 baby tooth extraction, that's a lot of extractions, and we don't do that. So if it's a small cavity on a tooth which is near exfoliation, or even a big cavity and that tooth is already loose, then that's it, we can let it go. If it does not cause any problems, infections, it's rare when we let it go, but that's probably the only cases when we let it go. Why do we need safe baby teeth? A lot of parents are like, oh, okay, 20 cavities, not a big deal, baby teeth will fall out, not a big deal. Well, it's a big deal. Why? Because we need front teeth and back teeth, number 1, for speech, we form speech and pronunciation certain sounds. Number 2, eating ability, chewing ability, biting ability. Kids which have chronic dental problems, they actually don't eat well. There's a study that shows that kids don't gain enough weight and actually lose weight, and their diet is not a really proper diet. They probably refuse to choose any solids. They more on a kind of a liquidish diet. And we need to chew, and we need to use our facial muscle in order to build nice skeletal structures. So it's all interrelated. Also, your kid can be in pain from untreated decay. And actually, one of most common reasons for missing school is actually dental problems. So your kid can develop an abscess or problem or pain, and they can focus at school. Their performance go down, they're missing school now because of dental infection. So it's all interrelated. I don't know why some people think that cavities are not important as other dental diseases. This is all part of your whole body, guys. You can't just ignore one part of your body and say, oh, it's okay, we'll leave it alone for now. Tooth attached to the head again. Also, teeth are important for space maintenance. So if I see a 4-year-old and now I have to pull his second molar, which is most important tooth for a pediatric dentist, because I cannot do space maintenance. If we're missing a teeth in the back, we have to put space maintainers. So if I pull his second molars, his 6-year-old permanent tooth will come in and gonna shift forward. Now we're permanently blocking his adult tooth under the tooth we're missing. Now it's becoming a big deal. Overall, pediatric dentists don't like pulling second molars because it's such a big deal for us. So space maintenance is very important as well. So if you look on the overall picture, teeth do play a big difference. Not that I'm a pediatric dentist, it's just my profession and patient. It's just, we see it every single day. We want your kid to be healthy, have good smile, has good function. And when we see kids who are in big distress because it was neglected, there's such a thing as dental neglect for their whole life. Now I see them first time at the age of 5 and they're terrified because they have no idea what am I doing. And with me, even playing with them, showing them everything, they still can be very, very scared because you as a parent did not prepare them in advance, did not take them to a dentist because you thought baby teeth no matter. So now you know, and share this video with all your friends and let them know that baby teeth are important. We need them until your child grow up and has adult teeth. Thank you so much for watching and can't wait to see you again. Bye.